You are watching the DocTalk show. You are watching the DocTalk show. Today, we give you a sneak peek into the rounds that Dr. Jane Balagade Kambugo has to do in the Cancer Institute Pediatric Ward, spreading more than compassion and hope, a helping hand to children battling cancer. You are watching the DocTalk show.
Acute leukemias are one of the most aggressive forms of the blood cancers. It can progress within a matter of months, starting from a simple illness that goes as far as severe complications, ultimately resulting in losing the child. So we want to understand, with regards to leukemia, is there any treatment available, particularly for these acute leukemias, because they seem to be the ones which are most worrisome? They have very little time they might have little time to catch it and to actually treat it. Is there any treatment available for these acute, or for leukemias in general?
So leukemia in children, there are two main forms. One is the acute lymphoblastic leukemia, which is by far the most common for children, very highly curable. And in high-income countries, we're talking about cure rates sometimes in the excess of 80%. By that I mean, if you have 100 children that present with the very same disease, 80% of them are curable, acute lymphoblastic. And then we have the acute myeloid leukemia, which is also curable, but requires quite a bit more treatment than the acute lymphoblastic leukemia to treat, and it can be quite toxic. So to go back to the acute lymphoblastic leukemia is treatable even here in Uganda and curable even here in Uganda with chemotherapy for the most part, and some children may require radiotherapy depending on certain risk factors we might find when we evaluate them. The chemotherapy, if I could speak more about it, consists of various drugs that are given for various durations of time, but in a manner that is tolerable. I think by far what is most challenging in the treatment of acute leukemia, acute lymphoblastic leukemia for parents, is the duration of treatment. Because we're talking 3 years for girls and 4 years for boys.
That's a very long time.
So that's a very long time.
On
chemotherapy. But it is usually the first 6 to 9 months where the treatment is really intensive, where they need to be in and around hospital. Thereafter, we see them for the subsequent 2 years for girls, 3 years for boys, once a month. So in the subsequent 2 to 3 years, they can actually go back to school. But the 6 to 9 months of intense treatment, that is where it's very challenging, and many times they will lose that year of school. But
it's given on a weekly basis.
Because it's given, we see them 2, sometimes 3, sometimes 4, sometimes every day of the week, depending on the phase of treatment. So the treatment is divided into blocks. So we normally like to look at it in 1 month or 2 month blocks. And so depending on the block of treatment at which you are, we may see you as frequently as 4 times every week, like Monday, Tuesday, Wednesday, Thursday, during which you're with us for more than half the day. So I think the thing to note here is that, with the exception of the first few 1 to 2 weeks when the baby is ill, the acute lymphoblastic leukemia therapy is predominantly outpatient. Yeah, and it's very well tolerated, and it is very curable even for us here. And even at the Cancer Institute, we have the drugs required for the treatment. Once in a while, we stock out. Yes, they are available for free. For all the drugs that we have at the Cancer Institute, and nobody's charged for them. The Cancer Institute now has access to 80% of the drugs at any one time that are required. In children, it might even be more now, 90. So once in a while, we may run out of the drugs for short periods of time, during which time parents might be asked to go and purchase. But that doesn't happen very often, and certainly not for the acute leukemias. Usually we have the drugs for the acute leukemias, which is a very encouraging thing, which is a very different story than what used to be the case about 5 years ago.
The
acute myeloid.
The myeloid.
Yeah.
You said it was more difficult. Why is it difficult?
So the acute myeloid leukemia is a challenging cancer to treat wherever you are in the world, because its treatment is shorter. We're talking about 4 months, usually, maybe more. But it's very toxic treatment because it requires very intense therapy to treat. That might actually even include stem cell transplantation, depending on the type of acute myeloid leukemia that you have. And so for us here, we are limited in our treatment of acute myeloid leukemia, because it's not that we don't have the drugs. We actually do have all the drugs, but it is our ability to support the children once we've given them these drugs. Because they are very sick. Some of them might require ICU. Some of them are very sick and require things like feeding through the vein. Some of them require high-end support. Yes. Some of them require blood products like blood transfusions, platelet transfusions, and of recent you've heard about the crisis with the blood bank, where we are waiting with a child whom we give therapy, and then the blood bank has no blood.
And so I think also not forgetting the environment around, because the children, this medicine causes kind of like removes all the blood cells.
So it could, So they are all that. I wouldn't worry too much about that, because there are things we can do to mitigate that.
You don't worry about infections coming out.
So we do, but dealing with the infections is not my biggest worry, because that's our bread and butter, because almost all our chemotherapy regimens wipe out the marrow. And in terms of infections, and there are ways in which we can control for that and put them on prophylactic antibiotics and advise parents. Parents are normally very good in observing precautions for infections. But it is all the other things that come alongside treating for acute myeloid leukemia that make it a very, very toxic chemotherapeutic regimen. And also a good number of them, their underlying genetic transformations might require stem cell transplantation. In Uganda at this time, bone marrow.
New bone marrow cells.
Yeah.
That's what it would mean, the stem cells.
Yeah. And in Uganda at this time, we're not yet able to appropriately determine which children would require that, because you need to do sophisticated genetic testing on the cancer cells. And that's what we're trying to move towards, so that you can safely identify who are the children who would benefit from this and who are the children who would not benefit from the transplant therapy.
So after the break, we shall explore more about other types of cancers. We had focused mainly on leukemias because it's the most common. So remember, you can send in your questions and comments on our social media platforms, and we'll ably respond to them.
You are watching the DocTalk Show.